The American Psychiatric Association approved the 5th edition of the Diagnostic and Statistical Manual, or DSM-5, a few days ago. Almost immediately, critics voiced concerns over changes to autism spectrum disorders and other categories. Joining me by phone is Dr. Timothy Murphy, a member of the San Diego Psychiatric Society and president-elect of the California Psychiatric Association. Dr. Murphy, thanks so much for joining us.
Thank you for having me.
The DSM-5 takes a lot to get that updated. What goes into revising it?
Well, it was a tremendous undertaking beginning in 1999 with a planning conference held in Maryland. Following that, there were a number of national and international conferences identifying which areas needed updating and where new scientific research indicated that there was really a requirement to revise the way we diagnose conditions.
And were these based on clinical trials, research trials? I mean, what is the basis for these changes?
The basis involves problems with the existing diagnostic criteria showing overlap, other diagnoses not being used, and then other diagnoses not really being consistent with emerging genetic research and other evidence that tells us that some of the diagnoses we had just didn't really make sense.
How often is the manual changed? I think it's been something like 20 years since the last DSM-4?
This will have been 19 years. Previously, it was 14 years between DSM-3 and DSM-4.
How long, let me ask you this, how do doctors use it in kind of layman's terms? How is this manual used? Is it kind of a Bible when it comes to diagnosing mental disorders?
Well, in a way, it's close to that. It's important that when I diagnose a person with a major depressive disorder or with autism, that I'm following the same criteria that someone across the country might be using. That's important for a host of reasons, and so that we can give better treatment to our patients. So, yes, we'll use it to make sure we're all using the same language and applying the same criteria.
All right. Well, one of the big concerns is over what I presume to be the proposed changes when it comes to Asperger's syndrome being regrouped into a new autism spectrum disorder. It is predicted, I understand, to shrink autism diagnosis by about 10%. What kind of impact could that have on families? Will it have any, I should say?
Well, I think ultimately it's going to improve our ability to treat our patients. There was what the work groups described as a mountain of evidence that Asperger's disorder is really just high-functioning autism. That the genetic research, the specific kinds of symptoms, I mean, they are identical. Asperger's is basically mild high-functioning autism, and to call it that will help us understand that a treatment that is effective for autism is also likely to be effective for some of the symptoms of Asperger's disorder and so forth. So it will help us more rationally apply treatment across the board. The reason for the 10% shrinkage involves more trying to tighten up the criteria for someone being diagnosed as having an autistic spectrum disorder, so that we are not being sloppy and calling folks who just may have some social awkwardness and mistakenly calling them Asperger's or autistic.
All right. Well, there's certainly still a lot more discussion to be had on this. Dr. Timothy Murphy, president of the California Psychiatric Association, thanks so much for talking with us by phone today.
Thank you.
All right, and here with me in the studio to talk more about concerns over Asperger's reclassification is Nicole Hope Moore, president-elect of the Autism Society of San Diego. Nicole, thanks so much for joining us.
Thank you for having me.
Tell us a little bit about the buzz. What's going on in families here in San Diego when they heard about these changes to the autism spectrum disorder and Asperger's syndrome?
Well, there's heightened anxiety that's taking place right now among parents. Some are concerned that their children may lose their diagnosis. Some are concerned they may lose services as far as in their child with Asperger's. But the Autism Society functions within the county to meet the needs of all individuals affected with any type of autism spectrum disorder. So we do not differentiate between any of them. We'll just continue to help those families and individuals meet the community resources that are available.
They're in a broad category with
Yes.
you. What about at the schools? One of the concerns is that this will affect educational services or special needs services. Are the schools saying anything about it?
Well, currently, as this is all evolving, we're just functioning to try and bridge that gap between the schools as well as the families and the parents and the individuals, just to make sure that if they happen to lose their classification, how to still access resources and just trying to make sure everyone stays on top of the trends.
Tell us a little bit about the Autism Society here. If there is a family listening to this who maybe has somebody newly diagnosed or they just don't quite know what you do, what can you do for them, especially in light of these changes?
Well, we offer over 40 support groups and informational sessions throughout the county, from the South Bay through North County, and we're constantly trying to educate the parents and individuals so that they are able to advocate for themselves more. With all of these changes that are taking place, we believe more than ever it's important for the parents to be able to advocate for their child so that they continue to prosper and improve their quality of life as they continue to deal with this diagnosis.
All right, we're out of time, but there's a whole lot more information on our website about it, including links to your website. So Nicole Hope Moore with the San Diego Autism Society, thanks so much for talking with us.